It is a chronic disease that mimics many others, making it more difficult to diagnose. We're talking about lupus.
Yeah, and during this Lupus Awareness Month, one woman wants to help others in her position. WMAR2 News' Abby Isaacs joins her now with the story. Abby?
Well, Jamie and Kelly, Stacy Bynum has lived with lupus for over 20 years, and she joins 1.5 million other Americans with the disease. Now she wants to use what she's learned through her long journey to help others.
You know, I'm on a cocktail of meds. I take about 20 pills a day.
That's just a small picture of Stacy Bynum's life with lupus.
I had to have a kidney biopsy. My skin has been really impacted.
A disease she's been living with for at least 20 years.
I noticed my joints were just, they were like rusty. That's the best way I can explain it. I couldn't squeeze toothpaste.
A doctor originally diagnosed her with arthritis, but when the pain got worse and worse, she went back in and was diagnosed with lupus.
And I was in the fetal position for a few hours. I could not function.
After she got over that fear and shock, she started fighting back.
There are things that you just need to do. You just need to work through. I feel like I'm doing well.
She's also learned more about the chronic autoimmune disease, that it's much more common in African American women and Hispanic and Asian people as well.
In African American women and in Hispanic women, lupus is the 5th or 6th leading cause of death if the woman is under 35 years of age.
There's no cure, but it can be controlled. And Bynum says awareness is an important part of getting diagnosed.
I think that there's still some lag because this disease mimics so many other diseases.
She wanted to help others in her position, so she started a Facebook group named Sisters Living with Lupus.
For questions, if you're scared, if you don't know if you have lupus.
A source of education and also empowerment.
It's not that you're not going to have a bad day, you will, but there's a better way to navigate through it.
Talk to me about your shirt. The director of the Johns Hopkins Lupus Center says the disease is caused by about half genetic predisposition and the other half, things like viral infections. Environmental pollutants like insecticides also increase the risk. She says younger women should be on the lookout for rashes, swollen joints, and fevers. She says if you have any of these symptoms, make an appointment with a rheumatologist to get tested.